What's up? Oh, what's going on, chat? This is Dr. Chieftain Sunflower back with another live video. Tap in, tap in, tap in. Let me know how y'all feeling today on this beautiful Tuesday. And as you can see from this title, we will be talking about teeth. So tap in, tap in, tap in. I'm just doing a little housekeeping, giving my squad a chance to show up and join the live. Tap in, tap in. Hey. So I'm feeling pretty good today, y'all. I'm feeling pretty good. I am trying to change my live times and coming on a little bit earlier. So I won't be able to do this all the time, but for today. So tap in, tap in. And let me know how y'all feeling out there in these streaming streets. How y'all feeling in the streaming world? So we will be talking about oral health care. Did I do that right? I think I did that right. You know, I got to get my moderators. I don't know why I had two, but I don't know if I did that right. But welcome to the stream, guys. If you want to know the topic, you can do exclamation topic and it will tell you the topic, but this only works while we're live. So as you can see, we'll be discussing 150 facts every person with teeth should know. Okay? Drop your questions in the chat. Don't be afraid to interrupt me. I like questions. I don't mind them at all. They actually make the streams more engaging. So make sure you are following, subscribing, doing all of that good stuff, smashing that like button, not holding back, because this is free dental knowledge. Okay? I don't charge you. I just ask that you like, share, and or subscribe to the chat wherever you're watching it from. I'm just trying to get my TikTok folks set up real quick, and then we're going to dive into these 150 facts that every human should know about oral hygiene and oral health care. Okay? So if you with it, tap those hearts, man. Tap those hearts. That's all you gotta do is tap the hearts. Tap the hearts. Tap, tap, tap the hearts. Tap, tap. Hey, 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 hey. Tap in. Tap in. Tap in. Tap in. I need you to tap in. Tap in. Tap in. Tap in. I need you to tap in. Tap in. Hey, tap in. Tap in. I need you to tap in. Tap in. Tap in. Tap in. Hey, hey. But we ain't here for all that. We're here to learn about some oral health facts. Alright? So I need somebody to be on sound check. Let me know how the sound is doing, because I only have the visual. Sometimes I might not put the right stuff. What am I trying to say? What am I trying to say, chat? Y'all know what I'm trying to say. So if you can't hear me, let me know. Because we are headed to TikTok. Oh man, TikTok deleted my setup. So yeah, how is the weather where you are? If you on Facebook, you know Facebook try to block out my streams for some reason. So you won't be able to see this until later. Later, later. Alright. Let's get my TikTok folks set up properly. Hopefully y'all don't fall. And let's go live. I can only do an hour on TikTok, so make sure you follow me on Twitch. So yeah, let's tap in. 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 Peace, peace, family. Welcome back to the Hood to Hood podcast, and I am your host, Dr. Chiefess Sunflower, aka Dr. Sean. This is a podcast where we elevate the mind, the grind, and your smile, one step at a time. Okay? We're going to dive into something every human needs. The topic of oral health care. Teeth. And my crooked bun. Okay. The bun is going its own thing. So we have 150. I didn't say 15. I said 150. So we're not going to spend too much time on each one. I just want to go over each one in slight semi-baby detail so that we can get this information out. So I'm sure there's going to be something in here for everyone. Alright? It may be a little bit long, but we're going to get through it because this is what I wanted to do today. 150 jaw-dropping, smile-saving facts to help you elevate your oral hygiene routine or your oral hygiene IQ. That is one main goal and purpose of the Hood to Hood podcast, is to increase oral hygiene intelligence or your oral hygiene IQ. Just the things that you know about your smile and how it correlates with the rest of your body. It's also to break generational curses, and when it comes to health, that can be a generational curse from family to family, from person to person. You often find people come into the dental office and they'll say, well, I got bad teeth because it just run in my family. You know, that's just something that they say. And oftentimes, true enough, it may be because of the environment, the poverty, the lack of knowledge, the dental IQ, the intelligence. It's also many times just bad habits. So people will put their bad habits on their family history when really they just don't like to brush and floss. They don't invest in their oral hygiene. They invest in other things that don't really give them the long-term, priceless return of investment. With your teeth, with your smile, it's always going to be an instant return on investment, because guess what? You're protecting your confidence. You're protecting your facial structure. You're protecting your smile. You're protecting so much, your higher ability. When you go on interviews, you know, even if you say, hey, I want to go and be a dentist, you're going to need to take care of your teeth. Any field that you go in, you pretty much need to be solid with your oral hygiene routine. Okay? So hopefully these 150 facts will hit home somewhere, and I'm not going to waste too much more time with all the fluff and the muff and the duff. But we're going to get into it. So we will be talking about teeth anatomy, gums and tongue, oral hygiene routines, systemic health connections, aging, smoking, cannabis use, toothpaste, mouthwash, oral cancer, wisdom teeth, and even dental school. So, you know, get in where you fit in. I'm going to be here. Grab you a sip of water, that is. They be like, it's 5 o'clock somewhere. We drinking water right now. Alright, so this stream isn't just for my patients. This is for parents. This is for entrepreneurs. This is for people who smoke. This is for scholars, skeptics, soon to be smile millionaires. So let's get into it. Don't be afraid to drop your questions in the chat. You can interrupt me at any time. I do have to watch on TikTok because I'm on 2 different cameras, so this can get a little, you know. But ASIO to my Niji out there, ASIO to my melanated family out there, ASIO to all the kind beings out there. And yeah, I just send you positive vibes. So let's get into it. So our first part is going to be about knowing your mouth, the anatomy and oral basics, oral hygiene basics. Okay? So it's 150 facts, so I'm just going to be, you know, diving in. If I see a question, then I will stop. But I'm just going to try to get through this in a fun manner, you know. Before I get into it, I'm doing a consistency challenge where I have to show up every day as a new dental streamer while being a dentalpreneur. So I have to fit this in because this is something that I want to do, right? So every day that I come live, I either teach something, we go through a history lesson, sometimes we do oral hygiene, because remember, the three main purposes for this podcast is to break generational curses, to increase your oral hygiene IQ, and to spread positive energy through a host of topics. And another thing is that we don't sugarcoat shit. We don't do that. We tell it how it is when it comes to the history. We have debates. Sometimes you might not agree, but everybody has a different opinion. But we're not talking about history today. We're talking about teeth. So, number one, adults have 32 permanent teeth, including 4 wisdom teeth, most of the time. Sometimes you don't have all 32. Sometimes you can have more than 32, but these are outliers. Normally you have 32 teeth, including 4 wisdom teeth. Alright? I had my wisdom teeth extracted right before I went to dental school because I didn't want it to impact me while I was in dental school. They were causing some issues before I got into the program, so I knew, hey, I don't want this to be an issue when I need to study. You know, your teeth can hinder your progress. Alright? Number 2, enamel is the hardest substance in your body, harder than bone. These are starting off with some simple facts that most people probably don't know. I'm a dentist, so I always feel like more people know than they actually know. So that's why I feel like these are important things that the average person should know. Because you would think that your bone is harder than enamel, but enamel is the hardest substance in your body. So imagine that, and how cavities can form and destroy your teeth for something that is the hardest substance in your body. So when you think about what sugar does, and soda and acid does to your teeth, if this is the hardest substance in the body, just imagine what it does to your insides. That's why detoxing, eating healthy is important to prevent cancer, to prevent heart disease, lung disease, all types of infections. You want to make sure you're eating a healthy, balanced diet and drinking water, which most of us struggle with, but we have to do what we got to do because we don't want to break down the enamel, the hardest substance in the body. All right. Number 3, your teeth start forming before you're born. Tooth buds develop in the womb. Did you guys know that your teeth start developing before you are born? You can't see them, but the tooth buds are there. So when you have people who, you know, drink during pregnancy, or they do crazy things while the child is developing, it can have an impact on the way the teeth develop. All right. What's up, TikTok? It can have an impact on the way the teeth develop. Number 4. This might shock some of us. Number 4. Cavities are the most common disease in the world. More common than the common cold. Cavities. The most common disease in the world. But guess what? It's also one of the most preventable things, and it's so crazy how dentists stay in business just because people don't have the proper oral hygiene routine, or they don't have oral hygiene knowledge. I learned how to brush my teeth in the 4th or 5th grade from a dentist who came to my school. It wasn't taught in the house. It wasn't passed down. It was just something that I just ran into, like, oh, that's what the hell I'm supposed to be doing? Oh, I'm supposed to do it in circles? At this point, they didn't even mention the flossing, or maybe they did and it went over my head, but I don't remember the flossing. I just remember, hey, brush in circles. That's why a lot of people don't have flossing in their oral hygiene routine, because it was never taught in the home. So that's why cavities are the most common disease in the world. 9 times out of 10, if you're watching this right now, you have a cavity. Okay? But you can go and fix it. Invest in yourself, invest in your health. I'm gonna try to keep going because I can get caught up in one little fact when I gotta get to 150. Thank you for sharing, Ashlyn. I appreciate it. All right. Number 5, the tongue has up to 10,000 taste buds and also helps to clean your teeth. The tongue. The tongue is very important. So, when you're doing your oral hygiene routine, brushing and flossing, you also want to make sure you're cleaning your tongue so your food can taste better. Because if you're not cleaning your tongue, then you have a dirty tongue and maybe you have dirty food. Do y'all understand what I'm saying? Maybe you have dirty food because your tongue isn't clean. Your taste buds are covered in what you ate yesterday and the day before. So your oral hygiene routine should include brushing the teeth, flossing, brushing the tongue, maybe adding a little mouthwash for pizzazz, but we're going to get to that later. Number 6, the gums are the foundation for your teeth. You do not want to neglect them. Inflammation of the gums can cause your teeth to become loose and fall out. So that's why you want to floss between the teeth so you're cleaning that area where the gums and the teeth meet. You want to make sure you're brushing in circular motion, or my preference is always going to be the electric toothbrush and brushing at the gum line. Most people forget to brush at the gum line. They get the white part, they like, I'm good, but you want to go to the gum line, not be too aggressive, use a soft bristle toothbrush. Any questions, drop it in the chat. Drop it in the chat, fam. All right. Number 7, wisdom teeth often crowd the mouth. 85% of people get them removed, like me. I told you guys earlier, I had my wisdom teeth removed before I went to dental school because I didn't want them to be a problem. And they won't become an issue until you're in your late teens, early 20s, sometimes a little later, sometimes a little earlier. Well, not really earlier, but, like late teens. For me, I was maybe 26, 25 when I had that done. And getting your wisdom teeth out, I got all 4 taken out. I only used the laughing gas. I laughed like a hyena the whole time and nothing was funny. It was weird because you laughing but nothing ain't funny, and you feel weird because people just looking at you playing like, man, she can't handle the laughing gas. I couldn't handle the laughing gas. I should have probably got put to sleep. That would have been better, but I didn't. I didn't. So if you afraid to get your wisdom teeth taken out and they growing in like a train like mine, they was like pushing forward, causing some crowding, you want to make sure you get put to sleep so you don't have to remember that. All right. So let me know in the chat if you're watching this on the replay or if you're watching this right now. What is the status of your wisdom tooth? Your wisdom teeth, did you get all of them removed? Or do you still have them? Or do you not know? Me, I'm all 4 gone. All 4 are out the door. That sounds like my class slogan. All 4 out the door. No, out the door and all 4. I'm telling my age. It doesn't seem like it's been that long. Woo, time flies, y'all. Time flies when you're on a mission to, pursuing your purpose. It flies. Now we're going to get into part 2. This is oral hygiene and daily care. Oral hygiene and daily care. All right. Make sure you are liking, sharing, subscribing, commenting, and joining in the chat. But oral hygiene, know your mouth. No, I already did that part. I'm getting a little lost here. Oral hygiene and daily care. So, I talk a lot about oral hygiene and daily care on the Hood to Hooded podcast. Many of these things, my loyal people, replay viewers should know. But this is a test to see if you know it or have you been paying attention. And if this is your first time watching me live, then let's see what your oral hygiene IQ is when it comes to taking care of yourself. Oral hygiene, if you don't know, is very important to self-care. So when people talk about soft life, self-care, all of these things, oral hygiene has to be in the mix. You can't be talking about hair done, nails done, but teeth not brushed. You can't be talking about fit check, this check, J's on, but teeth not flossed. You can't be talking about vacay, doing this, doing that, but your teeth not cared for. Oral hygiene is very important to your self-care, to loving yourself, to your confidence. It just ties the whole body together from top to bottom. Okay? Top to bottom. So, you should brush your teeth for 2 minutes a day, twice per day. That's not too much to ask. Most people only do 45 seconds. They're like, done. They don't get all the surfaces. They're in a rush, kind of like our attention spans. Now, we can't watch an hour long of content because we're in a rush. Everything is 3 seconds. Everything is microwave. That's why the Hood to Hood podcast isn't for everybody, because some people want things very, very fast. All right, but you should brush for 2 minutes 2 times per day. 45 seconds is not enough. That's why the electric toothbrush have timers. If you don't have an electric toothbrush, you can watch the clock. You can do lots of things. Sing a song, put your favorite song on to help you brush for the right amount of time. It's just 2 minutes, guys. You spend more time strolling on any app that you name for longer than 2 minutes. So why not, brush your teeth? This is only going to help you. Okay? Number 9, flossing cleans 40% of your tooth surface. About 40%. So skipping it is like only showering the top half of your body and leaving the rest. Who does that? Nobody. Nobody does that. So make sure you're doing the whole shebang bang. We've been taught in the hood, where I come from, well, we haven't even been taught that, but, normally people just know to brush their teeth here and say, hey, brush your teeth. They leave out the flossing. But they're only teaching you half of the lesson. That's where Dr. Sean come in at. I'm here to teach you the full lesson about flossing. Okay? So if you floss, you're only helping yourself. When you don't, it's like taking a half shower. Like a half-ass shower. That's what it's like. Is he gonna get that? Ah, he's not gonna get it. Dang it. Ah. I might have to put y'all on hold for a second. Why didn't he pick that up? I don't think he picked up this call, guys. I'm sorry. Alright. So, where was I? Where was I, guys? Oh, we were talking about flossing and how it's like if you don't floss, it's like only washing half of your body when you take a bath. Okay? Number 10. Electric toothbrushes can reduce plaque 21% more than a manual toothbrush. Hope y'all can hear me. Let me know if you can hear me. Let me know. Can you hear me, guys? Did you guys hear that? An electric toothbrush, just by switching out your toothbrush, adding in the floss, you are already giving yourself 2 to 3 times more control over how long you're going to have your teeth. And I'm just keeping it real. So if you have an electric toothbrush, 21% more plaque will be removed. That's almost 25% more plaque just by switching the type of toothbrush you use. So if you're a parent out there, you have a problem with your kids brushing properly, get them an electric toothbrush. Make that investment. Because if you make that investment now, guess what? You only setting them up for success later. You're helping them get rid of more plaque. Soon as the teeth start touching, they need to learn how to floss. Taking them to the dentist. This is going to save you from getting calls from the school about toothaches. This is going to save you from getting calls even as adults. Hey mom, I need some money for this root canal. Because they didn't learn these habits when they were younger. Does this make sense? Is it making sense? If it's making sense, tap the hearts. Number 11, replace your toothbrush every 3 to 4 months after being sick. Or after being sick. So you see the toothbrush where it's all flat, the bristles are just worn out like they've been scraping concrete. It's time for you to change your toothbrush. Even if you have an electric toothbrush, change your toothbrush head every 3 to 4 months. Don't go forever with the same toothbrush because these things have bacteria, right? They have bacteria. So if you're not changing out your toothbrush, then you just making yourself prone to get sick or spreading germs. So change out that toothbrush. And especially if you had a cold or the flu or that C word that I don't like to say, y'all know what I'm talking about, 2020, you get it. Then make sure you change your toothbrush. You don't want to get sick. Much love and adoration, American Indian. What's up, Linya? I don't know if I'm saying that name right. I see y'all, my Niji. I watch your videos all the time. Thank you for always putting out the real American Indian history. Alright? So number 12, mouthwash can help, but it's not a substitute for brushing or flossing. So just because you use mouthwash because you like, dang, my breath smell really bad, let me just rinse with a little mouthwash. That's not enough. That's not enough, guys. It's actually doesn't really not what you needed to do. You need to actually get the toothbrush and the floss and do this every single day. Just like you eat every single day, just like you need water every single day, this is something that you should do every single day. Brushing your teeth and flossing your teeth has become kind of like working out. People put it in the same category as working out, even though these two tasks require totally different amounts of time, muscle, and energy. People have put brushing and flossing into the category where it's like, I don't really need to do that. The more you put it to the side, the worse your teeth become. You put it to the side and they just start to deteriorate on you. So don't get into the mindset where you don't feel like you need to brush and you're just covering up, patching up with mouthwash. That is not going to help your halitosis. Brushing your teeth will help. Flossing between your teeth to get the extra chicken that you had from last month between your teeth will help. Brushing your tongue helps. But avoiding this and just using mouthwash, that's not going to help. Okay? It is not a substitute for brushing and flossing. That's like I have a lot of patients who use their water flosser, and I like the water flosser, but I still feel like you need to still floss. Because people who use the water flosser, when I'm doing a deep cleaning, it doesn't do the complete job. So it's like a supplement, an additive, not something to replace the flossing. Unless you have manual dexterity issues, and that's different, but if you can floss, try to get the floss between your teeth. Trust me. Alright? Dry mouth. Number 13. Dry mouth increases your risk of decay. So make sure you stay hydrated. That's why you see me drinking some water. So if you suffer with dry mouth, you want to make sure you keep water next to you. I have a patient that has water all the time because the dry mouth is very severe. That can be caused by medication, certain diseases and issues that can cause it. Alright? Alcohol, smoking, these can cause dry mouth. And dry mouth puts you at risk for cavities because the saliva helps flush the bacteria, helps flush the food, it helps flush what you eat. out of your mouth. But if it's just dry, it causes it to stick like glue to your teeth. Your teeth can be really white and chalky, and the calculus can get hard. It's a bad situation when you have dry mouth. Happy Tuesday, pretty lady. Hi, Simply Redone. How are you? Happy Tuesday to you too. Thanks for tapping the hearts. All right. Number 14, baking soda is effective but can wear enamel if used too often. So every now and then I might put a little baking soda with my toothpaste just to give it a little bit more abrasiveness to remove stains, but I don't really recommend that. Like, you gotta be really cautious about using baking soda. So when you get baking soda, if you're using this like as toothpaste, like if you run out of toothpaste and you only got baking soda, that's different. But you don't want to do that every day. That's like, hey, this is the once you need to get the toothpaste because it's a lot less abrasive. The abrasiveness can cause your enamel to wear down, which can lead to sensitivity. So that's why you want to be careful with baking soda. Put it in your hand and feel how gritty it is. It feels kind of like sand, like very fine sand. So think about sanding paper. Like if you paint and you want to smooth out the paint and you sand it down, that's what baking soda does. Anything that's abrasive is going to be like baking soda. Like charcoal is like baking soda. These are going to wear your enamel down. So that's why your teeth appear whiter, because you're basically rubbing a layer of your enamel off. So be careful with baking soda. All right. 15, charcoal toothpaste. I just mentioned that. Mostly marketing for brighter teeth, but it's abrasive and not ideal for long-term use. So just like baking soda, charcoal toothpaste is in the same pot. I wouldn't use that for longevity. If you've been using it and you like it and your teeth look whiter, it's because you're probably erasing a little bit of your enamel each time. So be careful with those abrasive substances. Do your research to see how much of these, sand-like substances they have in them. And be careful. And ask your dentist, of course. Number 16, brushing too hard can cause gum recession. So, how many of you guys out there, you got the toothbrush in your hand, you act like you finna go to war, you just like you doing too much. You're doing too much. You are brushing way too hard. You're brushing too hard. You don't need to do like this and scrape your gums, because that's not helping you. That's actually hurting you. And if you go to the dental office, your dentist is going to know immediately, oh, you've been brushing too hard. It's called toothbrush abrasion. And if you have a toothbrush and your bristles are flattened, like you making bristle pancakes, then you need to ease up the grip a little bit. Just ease up. It doesn't take that much to get plaque off. But if you have calculus, this is a whole nother story. Brushing that hard won't get it off. It's kind of stuck like Gorilla Glue. Gorilla Glue. Hold on. I'm saying Gorilla. See? Stuck like Gorilla Glue. I'm saying Glorilla, but I'm talking about Gorilla Glue. Alright? So make sure you are not brushing too hard, because this can cause gum recession. You'll see a lot of people on TikTok, a lot of people pushing trends, and they may say, hey, use lemon and baking soda to get your teeth brighter. It's like magic. No, it's basically the lemon, which is acidic. It's the baking soda, which is very abrasive. This is going to erode your teeth. It's natural, but that doesn't mean it's always safe, especially if you already have sensitivity. So don't do that. So question, if you're watching this on the replay, let me know, do you use an electric or a manual toothbrush? Let me know in the chat. You use an electric or a manual toothbrush? And if you're using a manual, I'm going to recommend that you switch to an electric. Because why? It's going to remove 21% more plaque, aka butter, aka caked up food on your teeth. We getting right through these facts, guys. So we're going to teeth and the body connection next. Teeth and the connection to your body. All right. So 17, gum disease is linked to heart disease, diabetes, Alzheimer's, and stroke. Because some of those bacteria from your mouth can travel to the rest. Well, they do travel to the rest of your body. And if you have too many, this is going to increase your risk of heart disease, diabetes, Alzheimer's, and stroke. Just think about that. You probably thinking like, who knew that the teeth were connected to all of these systemic diseases? And if I had better oral hygiene or a higher oral hygiene IQ, I could take better care of myself, reduce my chances, or decrease the severity of these diseases if I already have them. When you get your mouth in check, your diabetes becomes better. You decrease the chances of things going crazy. Number 18, oral bacteria can enter your bloodstream and affect other organs, which is what I just said. The bacteria can go into your blood and go to other areas. That's like when we have patients who had it's really not the standard anymore, but when they used to have joint replacements, it was thought that the bacteria from the mouth could go to that joint, the artificial joint, and cause an infection, right? So they would have to pre-medicate with antibiotics to kind of kill the bacteria before we do any dental work, so it will prevent that infection from going from the mouth to that area. The same thing applies. If you have so much bacteria in your mouth and you're not handling it, it can cause issues in other places. So I'm not just saying this because, I just want you to brush your teeth. No, there's actually health conditions attached to when you don't know how important that 4 to 5 minutes a day is in changing the rest of your life. All right. Number 19, pregnancy affects the mouth. Many women experience gingivitis when they're pregnant because you have all of this blood flowing. Your body is working for two people now, so you can get inflammation. So it's very important for my future mothers out there to brush and floss your teeth, especially while you're carrying your seed, because that bacteria, remember, it can travel in your bloodstream. So make sure you brushing your teeth. Okay. Number 20, periodontitis increases your risk of premature birth. Did you guys hear that? So to the pregnant mothers, you like, okay, I know that I can have a higher risk of gingivitis while I'm pregnant, but did you know that it can increase your risk of premature birth when you have periodontitis? This means you have periodontal disease, the bone loss, the calculus, all of the inflammation. This can make you have your baby early. You definitely don't want that. That's how important teeth are. They can impact the life of your unborn child. Just think about that. Teeth are pretty powerful. Or I should say, you are pretty powerful when you take care of your teeth. But if you don't, they will definitely not take care of you. And that's a promise. All right. Number 21, teeth grinding, which is called bruxism, can come from stress, sleep disorders, and misalignment of your teeth. So if you're grinding your teeth at night, how many people grind? I'm not talking about, okay, never mind. If you grind your teeth at night, this can come from stress. You stressed out at your job. You know how you'll see the people in the gym and they're lifting heavy weights and they're like, eh. This is like a, grinding. They're stressing about lifting the weight, so they're like, clenching their teeth together. When you're asleep and you're stressed, you can grind your teeth. This can wear your teeth out and cause so many issues. So make sure you tell your doctor about that or decrease your stress. Even stress has an impact on your teeth. You see how fascinating teeth can be, guys? Maybe it's just because I'm a dentist, I'm like, oh, this is fascinating stuff. But not only is it fascinating to me, I feel like it should be fascinating to you as well. If you have teeth, I'm just saying. The more you know, the more you grow. And when you in the bathroom and you thinking about brushing for 45 seconds, you're going to be like, oh, no, Dr. Sean told me. And just picture me in your ear like, mm-mm-mm. Now, you know that is not long enough for you to keep your teeth until you old and gray. You got to give it another minute. Just one more minute before you hop back on Facebook. Just 1 minute. Add another minute and 15 seconds. Don't rush yourself. This is your self-care time. When you brushing your teeth, you should feel so good. You did something positive. If you don't have goals, make oral hygiene one of your daily goals. And watch how good you feel about yourself just by doing this every single day. My patients who actually, even though it takes some of them 30, 40 years to get the routine, once they get it into their routine, they feel so empowered, so much better. And then they're like, dang, I wish I could have did this when I was a kid. I wish I could have did this when I was a jit. I wish I'd have knew this earlier. Then I wouldn't have all of these issues. I wouldn't have all of these oral hygiene bills, dental bills. I wouldn't have these issues if I had just caught on to this routine earlier. Okay? Sleep apnea often shows signs in your mouth like scalloped tongue because you're breathing with your mouth open trying to catch your air. When you're like people who snore, they breathe with their mouth open and they have a issue with the airway, right? So that's number 22. Sleep apnea often shows signs in the mouth. So when you go to the dentist, they can tell if you have signs of sleep apnea. You need to get that checked out because that decreases your lifespan because you're not fully sleeping. This can make you tired. Number 23, bad breath, halitosis. Who has experienced halitosis before? Not from yourself. I mean from somebody else. I had a coworker one time. They had halitosis, and I mean, as a dentist, I wear masks, so halitosis doesn't really bother me. But this coworker, they had halitosis, like severe halitosis. I'm like, geez, what is that? But maybe they don't really know that they have halitosis. This is before I became a doctor. So have you ever had an experience with somebody who has true halitosis? When you don't put on, so maybe you are brushing and maybe you have something on the inside that is causing this. People don't know that. So not only is it caused by not brushing, it can be caused by liver issues or your digestive system. Okay? Number 24, your dentist might be the first person to spot signs of cancer, HIV, or autoimmune disease. Your dentist. I know in dental school, we used to do the rapid response HIV test, which as dentists, we're qualified to do the rapid response HIV test because it's an oral exam and it doesn't take that long. I really should start offering that in my office, but I feel like those topics aren't really broadcast the way they were when I was growing up. HIV was all over they talked about it a lot. But now you don't really see that too often. Unless I'm just not paying attention, but it's just not talked about as much nowadays, I feel. But you gotta know your status, protect yourself, all of that good stuff. But cancer is something we definitely detect often in the dental office. Within my first 3 years of being a dentalpreneur, I have really seen about 10 to 15 cases of oral cancer. Some of them were super severe, where the patients really they lost their tongues, their throats, so it was really severe. And some of these were caught early where it was benign. But I'm always on the lookout for oral cancer. So if you smoke, if you have suspicious lesions in your mouth, make sure you get it checked out sooner than later. Don't wait, because waiting can be the difference between life and death. Alright? So that's oral cancer. So remember, guys, we're just gonna take a quick pause. The mouth is the mirror to your entire body. It's the mirror. That's why they say a healthy mouth is a wealthy mouth. A healthy mouth is a wealthy mouth. I didn't say a veneer mouth, a perfect smile mouth. I said a healthy mouth is a wealthy mouth. From a dentist perspective, many of my patients come in and they're like, "Oh my God, it's so bad, doc. It's so bad. It's so bad." Like, you can be thinking that your mouth is so bad and you're not even paying any attention because you think that it's not like veneer smile. It's not perfect and white. But do y'all understand that a healthy mouth is a wealthy mouth? Your natural teeth, priceless. A veneer can't do that. Veneers come with a lot of maintenance. So if you thinking that you're going to not take care of the natural teeth that you have and get veneers and it's going to be a wrap, you still got to brush and floss a lot more. This is very involved once you step into the veneer lane. Once you step into, you know, cosmetic procedures, you have to take care of these things. They come with maintenance just like your regular teeth. So I would highly advise, even if you want veneers, you still have to have immaculate oral hygiene routine. You can't skip it, regardless. So if you have your natural teeth, take care of them. Because a healthy mouth is a wealthy mouth. Not a wealthy mouth is a healthy mouth. A healthy mouth is a wealthy mouth. A pain-free mouth is a wealthy mouth. Even if your teeth don't look perfect in the mirror, but they still function, they're clean, you don't have cavities, that is a wealthy mouth. That's a wealthy mouth. All right? Do we have any questions? I'm going to take a little pause. We on number... Ooh, we got a long way to go, y'all. But as a streamer, you know, this is what I'm doing today. Drop your questions in the chat. Thank you for the hearts on TikTok. All right, let's keep it moving, because I really want to get through this. Y'all feel free to interrupt me anytime. Just feel free to interrupt me. I don't mind. So where was I? We are going to part 4. Lifestyle impact, smoking, diet, and more. The lifestyle impact on your teeth. What impact does the lifestyle you lead have on your teeth? Number 25, smoking stains your teeth, causes gum disease, and increases oral cancer risk by 10-fold. Smoking stains your teeth, causes gum disease, and increases oral cancer risk by 10-fold, especially nicotine, cigarettes, vaping. Okay? Number 26, weed causes dry mouth, which leads to more cavities. So you remember earlier we talked about how the saliva rinses the mouth, keeps the tissues hydrated. Weed is going to cause dry mouth, which leads to more cavities. So if you smoke weed and you don't brush your teeth, you're definitely going to have a lot of cavities and a lot of issues. Because oral hygiene is key. It's key. Number 27, vapes are not safe. So vapes primarily have nicotine. Some of them have flavored nicotine, which is banned in a lot of places. This causes your blood vessels to shrink in your gums and leads to dry mouth and a lot of issues. And studies even show, like, if you're vaping, this is more addictive than just smoking a cigarette. I'm not saying go smoke a cigarette either, but vaping is not like, oh, I vape now, I don't even smoke. It's actually worse. To my high schools out there vaping, drop the vapes. To my adults out there got the vape, just because you can't see the smoke, your mouth is, the blood vessels in your mouth are dying. Alright? Number 28, sugar. Now we know about sugar with cavities because that's the main talking point as a dentist is sugar and cavities. That's the main talking point. So sugar is the number one enemy of teeth. Why? Because it sticks to the teeth. The bacteria love raw sugar. It's like, woo, yes, that's their favorite form. A food is the sugar. Everything you eat breaks down pretty much to sugar, so they love that when you can just give them straight sugar. Like what? That's the number one enemy is the sugar. That's why dentists tell you, hey, stay away from gummies, soda, candy. I eat candy every now and then, but every time I do, I feel guilty for my teeth. Like, dang, this candy is just going in my pits and fissures and just destroying my teeth. I need to brush my teeth. So if you're a parent out there and you feed your children candy, you buy them every candy in the world, you're giving them processed cereal that have candy in it, then they're going to have cavities. Try to limit them from being addicted to sugar. It's like one of the worst addictions to have now is an addiction to sugar. It's so unhealthy, guys. You stroll TikTok, you stroll Facebook, the chefs are off the chain. They're making everything possible that you can eat. But remember that the sugar kills your teeth. 29, citric acid like lemonade erodes the enamel. So those energy drinks that you like, that's going to erode the enamel. Just like Sprite. Like if you have Mountain Dew mouth, all of the acid erodes the enamel. Even lemonade, and I love some lemonade, y'all. Remember, lemon, baking soda, the lemons are acidic. The citric acid erodes the enamel. It seems like, dang, you really need to protect your teeth after hearing all of this. It's like, dang, Dr. Sean, I didn't know teeth was so involved with my life like this. Yeah, they like that. They're very involved with your everyday life. All right? And number 30, drinking water after snacks helps to cleanse the mouth. So water is always going to be one of the teeth's best friends because it's not acidic. It's not going to destroy your enamel. It kind of mimics saliva. No. It kind of mimics saliva, so it's going to keep your mouth super duper healthy. So if you have an option to choose soda or water and you're thinking about your teeth, always go for the H2O. Always go for the H2O. Always go for the H2O. Always. Okay, I'm getting sidetracked here. Always go for the H2O. Alright? Moving on to our next part, which is dental industry, history, school, and the stats. Number 31. It's saying, from what I found, that the first dentist was Hesi Ra in Egypt, 2600 BCE. I meant BC. But I feel like, dentistry has forever evolved, and it's not like a new science. They've always been trying to make new techniques, new procedures. We have different, dentistry is super evolved now, but it started a long time ago. Okay? Number 32, George Washington, the first president, which I don't really do George Washington because he enslaved people and some kind of way he on the money. I don't really fool with him. But he had dentures made of ivory, not wood. They say he had wooden dentures, but they were made of ivory. So back then they were trying to figure out how to replace the teeth. I bet it was very weird back in those times with the dentures, because people don't like dentures now. I don't really. Classmate Nash, he pretty much, Nash, I don't want to do this. Listen, my professor, Dr. Tyus, one time, he even sat with me after class and helped me do my denture because that's how bad I hate dentures. Like making them. But now as a dentist, we send it to the lab and it's a lot less invasive. But in dental school, listen, Without Dr. Tyus and Nash, I don't know if I would have made it through that part of the lesson. Gotta give credit where it's due, man. Alright, but anywho, besides that point, where was I? Oh, number 33. Tooth worms were once believed to cause decay. Before we learned about germs and bacteria, they thought there were tooth worms that were causing decay back in the day. Number 34. Black dentists have made powerful contributions to the industry, aka the NEG. So Dr. Ida Gray Nelson Rollins, the first black, I don't like that word, but NEG woman dentist in the United States. Dr. Ida Gray Nelson Rollins. All right. Number 35. Dental school is typically 4 years after you graduate from college and very competitive. Now, I did learn in my implant training on this past Friday that in some other countries, the dentists aren't held to a prestigious level. They don't really, like, their pay isn't like crazy. The school is like a BDS degree, and and people would rather go to be I think he said taxi drivers versus a dentist, because it's not the same in America. So he was like, if you're in America and you're a dentist, be grateful, because we demand our respect over here. It's not like that all over. And dental school is very hard to get into. Now, I didn't have straight A's, but I did have a story about coming from adversity, and I think they saw my passion, and I think it was a combination of the passion, the community service, my story, my drive, and the test taking skill. It's a whole bunch of things that determine if you are competitive to get into dental school, because it's not a joke. It's not for everybody. Everybody don't need to get in unless they really serious about becoming a doctor. And you got to really lock in pretty much from a child. Like, lock in. I locked in the beginning of college, and then I locked in, because I didn't want to become a dentist the entire time. Only once I got to college. Before then, I wanted to be a medical doctor. I thought about being like a brain surgeon and all kind of stuff. Then when I got to dental school, I had this classmate named April, and she was already locked in. And I was like, dang, I never thought about dentistry, especially being a melanated woman. I didn't think about that. And then when she said it, I did research, and it was a wrap. But it was 4 years of undergrad for me at Florida State University. And then it was a year and a half at University of South Florida, and then I got into dental school. So it's very competitive. Yeah. Number 36. Average dental school debt in the U.S. is over $300,000. Number 37. Only 4% of U.S. dentists are melanated, despite us being 13% of the population. Okay? So at NEG, we only 4% of dentists are black, aka NEG. Despite us being 13% of the population. That is by design. You can't tell me otherwise. It's by design. It's meant to keep us out. But we still rising. That's why they need more diversity in this field, because, we just need more of us. I hear too often, dang, I've never seen a black dentist. I hear that so often, even from my own people. All the time. It's like not even a rare thing for me to hear that. I hear that a lot. And it shouldn't be that way. But nowadays, with social media and streaming and all of these different things, kids don't really want to go to these professions as much. But I think that that's going to be a problem, because we need more melanated dentists. We need more melanated doctors. We need people in the engineering professions and the law professions. We need people to want to do these things. But not only to want to do it, but do it at a level where they're happy, they enjoy it, and it's not just all about the dollar. It has to be about the passion and the purpose. So hopefully this Hood to Hood podcast will connect with at least one person to make them consider a career in dentistry, whether that's a dental hygienist, dental assistant, or being a dentist. What's popping up on my TikTok? Hey TikTok, thanks for the hearts. Help me get to at least 100 hearts, guys. Tap those hearts. Alrighty, even on Facebook, tap those hearts, guys. You can interrupt me anytime. I'm doing 150 facts every human should know about oral hygiene. This is gonna be, good information for us all. Even if you need a refresher or a reminder, or you never had dental oral hygiene education, this is the master class for you. Welcome to the room. But you can interrupt me. Welcome to the room. Uh-oh. TikTok, they trying to shut y'all out over here. Oh, oh. Oh. Alright. We back. We back, TikTok. Alright. Where was I? I think we're making good grounds. We were on 38. Dental anxiety affects 36% of people. Dental anxiety. This is definitely a fact. Half of my patients have dental anxiety. They come to me because they have dental anxiety. They're like, I have dental anxiety, Dr. Sean. I heard that you're good with that. And I haven't been to the dentist in 10 to 15 years. Can you help me? And I help them out. A lot of times the dental anxiety is about understanding what is causing it. Did you have a traumatic experience at the dentist, which is normally the cause of it? Are you just afraid of the needles, which is another big factor, and pain? Those are the three things that people have when they have dental anxiety that I see. They have some past trauma, afraid of needles, or afraid of pain. I'm afraid of needles. I'm afraid of pain. And if I had a traumatic experience, it's definitely going to impact me now. But how do we move forward from that? Because that affects 36% of people. So if you have dental anxiety, don't let that keep you out of the dental office. Find a dentist who understands you, that you feel comfortable with. Okay? Because 12% of people just avoid going to the dentist altogether simply because they have too much anxiety. They do not trust the dentist. And I met some mean ass dentists, so I understand. Okay? Moving on to part 6, which is oral cancer, aging, and longevity. We are on number 39. Oral cancer oftentimes is painless, but deadly. So that's why checking in your mouth, if you have suspicious lesions, getting these evaluated, maybe getting a biopsy early is very important, especially if you vape, especially if you smoke. I had a patient who was a vapor, is that a word? She stopped because she had a lesion immediately. Because it's scary. When you get that lesion, it's like, oh, now I have to stop. Because something is going on. So don't wait until something to pop up. Go ahead and stop ahead of time. And make sure you know your mouth. If you feel something suspicious, don't let it linger. Get it checked out. Don't keep going to work. I check it out later. Because every day that you don't check it out, you are putting yourself at risk for oral cancer, which is very aggressive and very deadly. And even if you're able to survive it, many times you can lose your tongue, you can lose your throat, you can just some of your face because it's very aggressive. Okay, guys? If you have a parent, a sibling, anybody in your family, they say, dang, I got a bump in my mouth, have them check it out. Do not sleep on it. Alright? Number 14, look for ulcers that don't heal, white patches and lumps in your mouth. These are signs of oral cancer. Let's repeat that again. Ulcers that do not heal. They can be red, white patches in your mouth. Okay? Or lumps in your mouth that do not go away. Get this checked out immediately. Don't even play with it. If the biopsy is $300, pay the $300 because guess what? You better be safe than sorry. Because what if it is something? If you catch it early, it's not as difficult to treat. All right? Number 14, regular dental visits can save your life, which we know with oral cancer. Going every 6 months can save your life because the dentist normally should do an oral cancer screening. This is normally the standard. We do it in our office every time, but I don't know. But normally they should do it. And if they did it and you want to know the results, hey doc, what are the results from my oral cancer screening? Even when I was at the Brooklyn Hospital Center during my residency, we would go out on Saturdays and do free oral cancer screenings for the community, which was really fun. I really miss New York, Brooklyn area. Like, so fun. That's just a little sidebar. 42. Older adults are at a higher risk of root decay and gum disease. Older adults. So as you get older, your teeth get older, the enamel gets weaker over time. If you didn't have good oral hygiene routine, you already have cavities. It just gets worse. The bone loss, the gum disease gets worse as you get older. It's a higher risk of getting worse, I should say. All right. 43. Medications can reduce saliva, increasing tooth loss. So when we talk about dry mouth, sometimes a dry mouth is caused by the medication you take. But sometimes you can't stop taking the medicine, so you just have to learn how to manage the dry mouth. But as you get older, this becomes an issue. Number 44. Implants, dentures, and bridges all require maintenance. So if you think you're going to get an implant and not have to do nothing for the rest of your life, this requires maintenance. Dentures, they require maintenance because you can lose bone. You have to keep your dentures clean. Same type of thing. You think, oh, I just take all my teeth out and get dentures. You still have to clean your dentures every day. You know, that might even take longer than brushing your teeth. Brushing your dentures. All these things require maintenance. Your bridge. If you have a bridge right now, to the people who have bridges, these require maintenance. Special maintenance tools to get under that bridge. You can't just leave the bridge dirty and wait till you come to the dentist and then we go under it. It's like, dang, how long has this food been stuck under here? Alright? So just a quick question to the audience. How often should you visit the dentist? Is it A, once every 5 years? A, once every 5 years. B, once every year. C, once every 6 months. Or D, only when it hurts. How often should you visit the dentist, guys? A, once every 5 years. B, once every year. C, every 6 months. Or D, only when it hurts. Any takers? No takers? Alright. Every 6 months. That's how often you should visit the dentist. Every 6 months. Okay? Every 6 months. Let's keep it moving. Moving. We on 45. Oh, I got a long way to go. 150 facts that you should know about your teeth. 45. So this is a segment about toothpaste. Let's see if we can get through this. So 45. Fluoride toothpaste helps remineralize enamel and prevent decay, which is very critical for kids, I feel, and high-risk patients. So you can get a specialized formula from your dentist, but it's going to help prevent tooth decay. Number 45, whitening toothpaste can make teeth look brighter, but won't bleach them. Okay? They remove basically surface things. So I have patients like, dang, do you think the whitening toothpaste will get me to that bleach white? It won't get you that white, but it'll remove the surface things, you know? And that takes consistent use of the whitening toothpaste. Number 47. Sensitivity toothpaste works by blocking the nerve signals to expose dentin. A lot of them. But you need to use it consistently. So if you have sensitive teeth, I would recommend like Sensodyne. But when talking to the Sensodyne rep, it takes at least 2 weeks for the sensitivity toothpaste to work. So if you use it once or twice and you're like, dang, my teeth's still sensitive, you have to use it longer. And if you switch your toothpaste, it takes a while for it to build up on the teeth. So you have to use it for at least 2 weeks. Number 48. Natural toothpaste often lacks fluoride. Because people who want natural toothpaste, they don't want the fluoride. So this means you're prone to decay in a sense. But if you like natural, then hey, you like what you like. Use what you like. Number 49. Avoid toothpaste with microbeads and abrasive substance. This can wear your enamel down like charcoal toothpaste. Be careful with charcoal toothpaste. If it's a fad, be careful. 50. If you're using herbal or charcoal toothpaste, be mindful. Just because it's natural does not mean it's effective or safe. And I already talked about that already. So choose your toothpaste kind of like you choose your friends. You want something that is consistent, protective, and not too abrasive. And if you need help deciding which toothpaste is best for you, talk to your dentist. When my patients come in for their 6-month or their new patient, I try to give them the proper toothpaste recommendation. If you have lots of cavities and things are a disaster, then that's a prescription toothpaste. If you don't have a lot going on, then you need like a mild toothpaste like Sensodyne Pro Enamel. If you have some bleeding gums, some gingivitis, then you need something like Parodontax. That's made for bleeding gums. Okay? But really you need to floss and see what is causing it. But that's just the start. Now we will move to the body connection. This is more information about how your body is connected to the mouth. We're going to fly through these. If you have a question about one of them, let me know. 51. Uncontrolled diabetes can worsen gum disease. Gum infections can make it harder to control your blood sugar. So if you have diabetes, make sure you are taking care of your teeth because this can worsen your blood sugar. 52. Gum disease may increase your risk of heart attack and stroke due to inflation. We talked about that a little bit. Heart attack and stroke because of the inflation. The bacteria that causes the inflammation in your mouth can go to your heart, your brain, cause inflation, and you can have a stroke or a heart attack. Alright? 53. Oral bacteria have been found in the brain of Alzheimer's patients. So you remember we said periodontal disease, all these things can lead to Alzheimer's disease, which is like a memory loss as you get older. So the patients who have had their brains examined, these Alzheimer patients, they found oral bacteria in the brains of Alzheimer patients. How? I don't even know what the word to use. How shocking is that? That's crazy. Number 54, chronic bad breath can be a sign of GERD or liver disease. So it may not be that you're not brushing enough. It could be a sign of gastrointestinal reflux disease or liver disease. So your dentist and your medical doctors sometimes need to work together to figure out where the halitosis or the bad breath is coming from, especially if it's chronic. It's not like just a one-time incident. This is something you really battle with. 55, and speaking of that, that can be so severe because I've had an experience with a patient who had an issue with like their liver, and it makes their skin have this odor. It makes their, not only their breath have this odor, but it's very difficult to treat. So they have a tough life. Like when they go to work out or just live their everyday life, they have this odor that they can't get rid of, and it's not their fault. They're brushing, they're taking a bath, but it's something deeper. Okay, number 55. Osteoporosis can cause tooth loss by weakening jawbone support. So if you have osteoporosis, this can impact, your teeth. because the teeth are supported by bone. So if you're losing bone, it's also going to impact your jaw. So all this here is bone. And your teeth kind of keep the bone in the face where it's supposed to be. Alright? But if you're losing bone, the teeth just wiggle out. Even without a cavity, even without pain. Because without bone, it's like having a flower in a pot with no dirt. Make sense? Number 56, Sjögren's syndrome reduces saliva, causing decay and infection. So whenever you hear loss of saliva, you're starting to see a pattern. You see decay. You see infection. You see dry mouth. So saliva is very critical to your oral health. But if you have something like Sjögren's, I don't even know if I'm saying it right, Sjögren. I always struggle with this word, even in dental school. Sjögren's, because it's spelled so weird. It's Sjögren. Sjögren's. Sjögren's. Whatever, you get it. So this is going to reduce the saliva. 57, HIV and cancer treatments increase your risk of mouth sores and fungal infections. This is because they kill all the bacteria. So there's good bacteria in the mouth, there's bad bacteria. But when you have these systemic diseases, the medication has to be strong enough to kill the HIV. It has to be strong enough to kill the cancer. In doing that, it kills everything. So then your immune system becomes weak. Your oral hygiene is very important then, because you're going to have a higher risk for mouth sores and fungal infections. 58, some seizure meds and blood pressure drugs can cause gum overgrowth. Alright? So some of the medications that you're taking for these conditions can cause the gum to really grow over the teeth. And that could be an issue. I had a patient with that issue as well, and it was severe. So we had to work with specialists to find a solution for it, to get it under control. But it's really severe. These patients really suffer dealing with these issues, and unless you have it, then you don't understand how traumatizing it can be. And if you are taking seizure meds and you notice the overgrowth, that's probably why. 59, gut health affects oral health. Probiotics can help balance mouth flora. So your gut health is tied to your mouth. It's all the digestive system. The digestive system starts in the mouth, goes to the gut, down to the toilet, right? So all of it is connected. So your gut health helps your oral health. Make sense? 50, bruxism grinding is linked to anxiety and sleeping disorders. So we know that bruxism is linked to stress, but it's also anxiety and sleeping disorders. I kind of already said that a little bit. 61. Vitamin C deficiency causes bleeding gums and poor healing. This is kind of reminding me of like a dental school exam review, because this is a lot of the concepts that you learn for those exams, those board tests, to know what these issues are, like scurvy, things like that. So vitamin C deficiency causes bleeding gums and poor wound healing. So if you're not getting enough vitamin C, your gums may be bleeding a lot more than they would if your vitamins were at the proper balance. 62, autoimmune diseases can trigger oral ulcers and dry mouth because your body is attacking itself. So the body and the mouth connection goes really, really deep. We've already talked about several diseases that impact the mouth. Alzheimer's, GERD, liver disease, osteoporosis, HIV, cancer, seizures, digestive issues, anxiety, sleep disorders, vitamin C deficiency, autoimmune diseases. All of these things have an impact on your mouth. It's so important to know these things, guys. Alright? Number 63. Your saliva contains biomarkers for over 1,000 health conditions. So they could just test your saliva and figure what is going on. You can have those specialized tests to see what is going on just from your saliva. That's like diabetes. They can test your saliva to see how your sugar is impacting your diabetes. Number 64, mouth ulcers that don't heal in 2 weeks You want to get those checked out because it could be cancer. That's just another one about ulcers. 65. Think of your mouth as the dashboard to your body. So if you notice inflammation, if you notice dry mouth, if you notice overgrowth, if you notice lumps and bumps, this can be a sign to the rest of your body. So you don't want to go and ignore it. If you have pain in the teeth, 9 times out of 10 you have a cavity. Your mouth is going to be key. And it's crazy how people disconnect the mouth from the rest of the body the entire time. Like, they won't brush, they won't floss. But if something goes on with the rest of the body, they focus on that. But sometimes it can be caused by the mouth. Like, you see Alzheimer's. Those bacteria from the mouth travel to the brain, set up shop because maybe the person had poor oral hygiene or periodontal disease. So don't let these bacteria control your whole body. 66. Cavities start as demineralization. Okay, so they can be stopped early. They even have different solutions that we can put on the teeth now to stop cavities without doing the drilling. But you got to go get it and catch it early. 67. Sugary drinks cause acid attacks that can last up to 30 minutes each sip. So when you drinking sugary drinks, just think the acid is going to attack your teeth for 30 minutes every time you sip. So if you drinking soda all the time, you mukbanging with Coca-Cola every day, you destroying your teeth. So let the sugary drinks go. It's okay every now and then, but if you get into the habit of needing a 2-liter every day, you got a problem. If you get in the habit of needing lemonade every day, you have a problem. So the parents out there giving their kids juice all the time, this could be a problem. The sugary drinks is going to cause an attack on the enamel. Remember, which is the hardest substance in the body. Okay? 68. Cavities between teeth often go unnoticed without an x-ray. This is why it's important to take your kids to the dentist. This is why it's important, mom, dad, aunt, uncle, cousin, brother, sister, grandma, grandparents, to go to the dentist. The x-ray is important. I have people come into the office all the time and they just want a cleaning. I'm like, we don't just do a cleaning. I need to see what's between your teeth, at least a couple of x-rays, so that we can make sure you don't have cavities that you don't know are starting. It's a lot easier to fix them when they're smaller. Trust me, just get the x-ray. Check it out. Get the feeling. It's going to save you a lot of money or save you from losing your teeth. So you can see the cavities on the front teeth. So people will come in, oh my God, I got a brown spot right here. I got a cavity. Not knowing all the teeth have cavities, you just can't see them. Okay? You just can't see them, guys. 69. Plaque is a biofilm, a sticky layer of bacteria, not just gunk. So when you see the butter, people call it butter on your teeth, this is like a biofilm. It has, the toxins from the bacteria when they're, eating your sugar, I could say. So they form a little sticky biofilm that sticks to your teeth. And then over time it gets hard. It becomes difficult to take off. So it's not just gunk. This is actually a process going on your teeth. So look in your mouth right now. Take your finger, make sure you wash your hand afterwards. But if you scrape and you notice something come off, that's that biofilm. That's the bacteria mixing with the sugar, the toxin, all that stuff is in the biofilm. With your saliva, that's biofilm. That's why you want to brush it off. It's not just nothing. This stuff needs to come off. Alright? Number 70. A tooth with a deep cavity can still feel fine until it hits the nerve. You got on my last nerve. That's what happens when you get a toothache. It's like you get on the last nerve and then all hell breaks loose. It's a disaster after that. You can't focus on nothing in the world but this tooth. Nothing in the world matters but this tooth. It just ruined your whole life. It's like, oh my God, nothing in the world matters but this tooth. that has a toothache. Once that tooth nerve get infiltrated, you will know. Now, if you ever had a tooth nerve get infiltrated and a toothache, then you know what I'm talking about. You will know. Life pretty much stops when you get a toothache. So don't wait until that moment. Listen to Dr. Sean today. Brush and floss your teeth. Go get the checkup. Fix those cavities. Get the x-rays while it's small. Okay? 71. Kids should see a dentist by the age of 1 to prevent baby bottle caries. To my new parents out there, they're like, my kid haven't been to the dentist ever. You only doing your child a disservice. It should be child neglect because you don't know what's going on with the oral health of the baby. Remember, the baby's mouth leads to the rest of the body. So if they are turning 1, they should have been to the dentist. The dentist can't do much, but just getting them in that setting mentally, for one, is training them up to be unafraid of the dentist. That's number 1. Number 2, it's allowing us to get in there, check out the tongue, make sure they're developing properly, make sure the teeth that have already erupted don't have baby bottle caries, because this impacts the longevity of their future teeth. The baby teeth are basically space holders. And when they get extracted too early, you get crowding, you get a whole bunch of issues that can be resolved by just, knowing about baby bottle caries and knowing how to prevent it and not allowing your kid to go to sleep with juice in their bottle at night or milk at night, because this is going to lead to baby bottle caries. All right? Number 72, cavities in baby teeth matter. They can affect permanent teeth underneath. I just said that. Number 73, dark spots on the molars can be pit and fissures, vulnerable zones for decay. So on your back teeth, your molars, the big guys in the back, those are the molars. You see how big they are? They're like the big football players in the mouth. I don't know if that really makes sense, but they're like the big jockeys in the mouth. They do all the crushing and the the chewing, and they, the front teeth incise. They like cut the food. The back teeth grind. That's why they're molars. They're like really big guys. So these teeth have a high risk of getting cavities, especially if you have deep pits in the teeth. You see how the teeth are like hills and valleys? When it goes down into that valley, some people have deep pits in the teeth and fissures and grooves. The teeth look very they look like a mountain range, I would say. Peaks, valleys, pits, and fissures. In those pits is where most people get decay. Which is why if you have children and you take them to the dentist early, once those molars start to come out, those permanent molars, the dentist can seal those molars so that they don't get cavities. Thankfully, my grandma took me to the dentist and I got sealants, which helped me prevent getting cavities. And I also had a good oral hygiene routine. And I wasn't a kid who just was in love with candy. Because I think that's also an issue, having a love for candy. You'll hear adults like, dang, I just loved candy when I was younger. I wish I'd have took better care of my teeth. I don't know how many times I hear that. I don't know how many times I hear that. All the time. Alright? 74. Something happened. 74. Chewing gum with xylitol can reduce cavity causing bacteria. You ever see xylitol on the gum? Instead of getting the sugar gum, the regular plain gum, try to get gum with xylitol. This can help if you like chewing gum and you just gotta have it versus chewing on sugar all day. Use the xylitol gum. This is gonna help prevent those bacteria from getting out of control. It's a win-win. You get to chew your gum and you get to kill some hating bacteria. Okay? Because the bacteria definitely your haters. 75. Night snacking and sleeping with sugary drinks is a fast track to a dental disaster. We just talked about baby bottle caries, going to sleep with sugary drinks, snacking in the middle of the night, all these things. Not only is it bad for your health, well, teeth are health. Not only is it bad for your diet, meaning your weight, but it's also bad for your teeth. Very, very bad. If you want a fast track way to come to the dentist Try drinking soda all night and eating candy. Then you might as well go ahead and get you a little bank account, put some money in there every month, so the time when you get those cavities, you already have the money waiting. Because you guaranteed to get cavities eventually. Now, I have met some people with some very strong enamel. They have poor oral hygiene. They don't eat right, but they don't get cavities. But that is like a unicorn. Most of us gonna get cavities if we don't do what we're supposed to do. Which is why I'm telling you guys this now. Do what you're supposed to do. Right? Next, we're gonna go to gums and periodontal health. We kind of already touched on that, but we're gonna touch on it a little bit more. 76. Red, swollen, bleeding gums are a sign of gingivitis, the earliest form of gum disease. So if your gums are red, say it with me. If they are bleeding, say it with me. If they are swollen, you have gum disease. Now, you could have periodontal disease, but you kind of need a dentist to diagnose you with that. But if you see your gums bleeding, red, swollen, you definitely have some form of gum disease. 77. Gum disease is mostly painless. That's why it's called the silent killer of the teeth. Now, you heard of high blood pressure being the silent killer, because your blood pressure can be so high and you don't know, you won't have any signs until you have a stroke. That's just like gum disease, because it's not pain. You may not have any cavities, but your gums will be red, bleeding, and swollen. This is a silent killer of your teeth because it just gets worse. This is a sign that maybe you have poor oral hygiene routine. Maybe your knowledge about teeth is like very slim. Maybe your oral hygiene IQ is non-existent, which is why this stream matters. It's not a common topic, but everybody got teeth, and most people don't know these things. And I want to make sure that we are elevating in this area. Okay? 78. Flossing reduces plaque and prevents tartar formation. Flossing, flossing, flossing. You will hear me say floss, floss, floss over and over, over and over again. Like, you should just know. Floss, brush. When you see me, just think about the floss and the toothbrush. Nah, when you see me, don't think about that, but you get what I'm trying to say. 79. If your gums bleed, don't stop brushing. Brush more gently and more consistent. So when I have patients who say, doc, my gums bleed when I floss, that's because you're not flossing enough, or you're being a little too rough. You need to keep brushing. Don't stop brushing. That's the issue of why it's bleeding. Why you have plaque buildup, because you're inconsistent. Be a little bit more consistent. Don't be afraid of a little blood. Unless you're taking blood thinners, that's something different. But if you're normal, you're young, you don't have any major health issues, you should be brushing and flossing your teeth. And if you have not done it consistent, then it is going to bleed, because it's not used to that. But let it happen. Go through the process. Your gums may be a little sore. When you start flossing for the first time, don't be alarmed. Get that floss down there. Do not let your teeth win. Do not let the bacteria win. Number 80. Woo, woo, woo. Periodontal disease is the number one cause of adult tooth loss. So periodontal disease, which means bone loss, causes tooth loss. So if you're losing teeth 9 times out of 10, it's because of periodontal disease. That is the number one cause why us adults lose teeth. Because we don't understand periodontal disease. We don't understand how it tied to the rest of the body. You think you're going to have these teeth in your head forever and you ain't got to do nothing, and that's not true. You have to invest in your smile. You have to invest in knowing about your teeth, understanding who you are. What is periodontal disease? Okay? 81. Smokers often don't show gum disease symptoms due to constricted blood vessels, but the damage is still happening. So if you smoke, you may not notice the inflammation, the bleeding gums, because your blood vessels have been damaged and they're constricted. So you're not going to notice it, but you still have the bone loss, you still will have the tooth loss over time. 82. Professional cleanings remove the calculus, the hardened plaque that brushing can't remove. Okay, so the deep cleanings is what's gonna remove that hard stuff that you see on your teeth that you can't get off with a toothbrush. Don't even try it. Just go to the dentist and get the deep cleaning. Excuse me. 83 deep cleanings SRP. Raise your hand if you've had one of those before. Is necessary once bone loss starts. If you ever had an SRP, tap the hearts. Put something in the comments. Let me know. Yes, doc, I had an SRP. So a deep cleaning is when we have to use needles to clean the calculus off. Nobody likes needles already, but if you're not doing what you need to do at home, it can get to a point where you need professional help to get the calculus off because it becomes stuck like Gorilla Glue. Alright? So to my youth out there, brush and floss. If it's not that bad yet, do it. Because most people get to the place where they need a deep cleaning, but they don't have insurance. And the deep cleanings are more than the regular cleanings. A lot more than the regular cleanings. So think about these things. Do I brush and floss every day, or do I wait for my dental health to decline and now I can't afford to fix it, so I'm just doomed? And a lot of people are just doomed because of this situation. Like, I wish I had had this lesson when I was in the 5th grade, when the dentist came, but he kept it more like 5th grade-ish, but, you know, I feel like I could have learned a lot more. We need to know these things. You got teeth, you need to know these things. Like, it's no-brainer. No-brainer. Even for your family, for your friends, it's a no-brainer. Okay? Number 80. What number we on? 84. Receding gums aren't just cosmetic. They expose root surfaces and increase sensitivity. So once you get the periodontal disease, you start to lose bone. Your gums start to recede. The tooth becomes long. Like they said in dental school, it get long in the tooth. You can see the root of the teeth. And then people who have periodontal disease, they have sensitivity all over their mouth now because the roots are exposed. And the root of the teeth are not supposed to be exposed. They are supposed to be covered with the bone, just like a flower in a pot with no dirt. So imagine a flower in a pot with no dirt, right? You go to water this flower, the water just gonna go all to the root. It's no purpose. That's how it is when the teeth is in the mouth with no bone. It starts to wiggle. It's very sensitive. It's just out of control. It's out of control. And you have to take the tooth out eventually because you can't root canal it. You can't crown it because it has no bone. And just flapping in the wind is like, I'm ready. I'm ready. Like my homie SpongeBob, he said, I'm ready. I'm ready. I'm ready to come out. That's what the tooth be doing. Flapping it. I'm ready. I'm ready. And most people don't want to go through that. The worst situation is when someone has neglected their oral hygiene for years, whether that's due to anxiety, and they were one of the 12% who just didn't go because they were too scared. They come in and all their teeth are saying, I'm ready, and they have to get all their teeth taken out. They don't have no decay. They don't have any toothache. They just notice, dang, my teeth are moving when I'm chewing. They're not being strong like I need them to be. I obviously got something wrong in the past. If I could prevent you from getting something wrong right now, I've done my job. If any one of these 150 facts was for you right now, I done my job. I know it's a lot, but I done my job. All right. So number 85. Bleeding gums are not normal ever. So if your gums are bleeding, this is not normal. Don't think that this is normal. If you go get a piece of floss, right, and you floss between, say you haven't flossed in a while, and it starts to bleed, that's not normal. It's not normal. Something is going on. That's the inflammation process. Something is going on with your immune system, where this bacteria is causing some abnormalities, and you need to kick this bacteria out. You gotta go, son. I'm flossing you out today, bro. Dr. Shannon already told me what you about. She already put me on game. How you come around the hood, you trying to make people lose their teeth, but I'm flossing you out, bro. That's what you gotta tell the bacteria. And it'll listen, it'll get out, but you gotta do the work. I know that was like a weird analogy, but you get what I'm trying to say. Number 86, we're gonna go into mouthwash myths and truths. Okay? Alcohol-based mouthwash can cause dry mouth if it is overused. So you know the old school Listerine that your grandma had that you it's like the gold kind, the old kind, the first kind. It's like woo, you can't even barely hold it in your mouth for 2 seconds. It's like grandma, why you got this strong? Ain't your mama mouthwash? It's too strong. So use an a non-alcohol based mouthwash. I like Act. I give my patients Act because it doesn't have the burning sensation. It gives them a nice minty, rinse without doing too much. Some people like the burn though. They feel like I'm cleaner with the burn, but it causes dry mouth. Okay, if it's overused. Number 87, chlorhexidine is a prescription mouthwash that I often prescribe. It's powerful, but it stains the teeth if you use it long term. So you can't use this for long term. A week or two is enough, especially if you have a lot of bleeding gums. You haven't been to the dentist in a while. Your mouth is just a lot going on. It's like you got a lot going on. We need to kind of settle things down, reduce the bacterial load. We'll put you on chlorhexidine or Paradex mouthwash to kind of help us with that. Number 38, fluoride mouthwash is ideal before bed, so don't rinse afterwards. So if you have mouthwash with fluoride in it, use it before bed and don't rinse it out. Let the mouthwash kind of work, but it's surface level, so I don't really know how well it's going to work because your saliva is going to rinse it off, but just the thought, use it before bed. Alright? Those cosmetic mouthwashes, the ones that claim to whiten your teeth, things like that, they mask odor. It's like if you just use a mouthwash, so you're in a rush, you don't want to brush, you just mouthwashing it up. This is not going to kill bacteria. It's just masking the problem. It's not going to do much. You got to do the full oral hygiene routine. I did several streams where we talked about the different levels of the oral hygiene routine. We're not getting into that today, but you have a different level. Whether you just brushing, that means you got a pore level. If you brushing and flossing, that's okay. But if you brushing and flossing, brushing your tongue, using the tongue scraper, that's a lot better. If you're using an electric toothbrush, flossing, using a water pick, you're going to the dentist, using the mouthwash, you got optimal oral hygiene. So there's levels to it. I said I wasn't going to go over it, but I did it kind of quickly. Alright. Number 90. Hey, using mouthwash without brushing and flossing is like wearing perfume on a dirty shirt. It's like wearing perfume on a dirty shirt. It's like putting on dirty clothes and putting on perfume. It's like putting on used underwear and spraying perfume in it. That's what it is when you use mouthwash without brushing your teeth. You really need to clean it before you try to use it again. Alright? You wouldn't put on a dirty shirt and put cologne on it and say, I'm clean. No, you really got to do all steps. Next, we're going to number 91. We already talked about less than 5% of dentists in the U.S. are black. This is just some more dental school and industry stats. Number 92. Dental school requires a strong science background and a high stress tolerance. Strong science background. I took so many science classes. I could have turned into a science book. From biochem to physics to chem 1 and 2 to I can't even name them all. Zoology, botany. I can't even think of them all. Neuroscience. What else? Molecular biology. It just goes on and on and on. Whew. Anatomy, gross anatomy. It just goes on and on and on. So in order to be a dentist, you must have a strong science background and be able to withstand high stress environment. Okay? Number 93, dentists are second only to surgeons for job stress and burnout. So notice, dentists are second to surgeons. We have high job stress, and you can get burnout if you don't know how to balance. If you don't put your self-care first. Number 94. Most new dentists graduate with 250 to a $500,000 worth of debt. It's very expensive in America to be a dentist. They gatekeep with the money. They gatekeep with the science classes. It's a gatekeeping career. So you really got to be serious when you pursue it. All right. 95. Many underserved communities are dental deserts. They have no access to care. So this is people in the country. They don't have a dentist near because dentists are rare. So they become dental deserts. They have to travel pretty far to get a dentist, especially one that they trust, that they like, that they're not afraid of. That's pretty rare. Number 96. Dental hygienists can clean teeth, educate patients, and monitor oral health. So if you're interested in dental hygiene, know that you can still clean teeth, educate the patient, and it's a very lucrative career. I highly advise, if you don't want to do the dental school route, to do dental hygiene. They make really good money. They make like $50, $60 an hour right now. It's 2 years of school. Yeah, they get the benefits. They running the show right now. Dental hygiene, they running the show. They calling the shots as far as their career is concerned. All right, number 7. Assistants are the backbone to every dental team. I've had some wonderful, wonderful assistants. They know who they are, but they're the backbone. I definitely miss some of my assistants. I can't even lie. I do. I had some really, really good ones. I wish I could just get them back. But, you know. 98. Continuing education is required to keep your dental license. So, with dentists, we have to learn all the time. I'm always taking CE courses, always trying to elevate, learn something new, perfect my skills, keep ahead of the technology because it's changing every day. So many companies, so many materials being put out, so many new rules and laws. So you have to really kind of keep up with your continuing education, which is why dentists are lifelong learners. That's why I push lifelong learning for anybody. Because if we have to do it, it should be required for everybody to just continue to learn about who you are. Continue to learn about the things that you like. Continue to learn and thrive in your profession. It's very important. So dentists is required to keep our license to be a lifelong learner. It's not a choice. So for most people, it's a choice. I don't have to learn nothing new. I could just keep the information I had from high school for 40 years. It's not going to work. You need a new skill. The world is going to pass you by if you're not learning a new skill, if you're not staying on top of it. Right? 99. Dentistry combines science, artistry, and psychology. Definitely facts. And entrepreneurship, add that too. So science, we already know dentistry is just a science-based field. Everything we do is science-based. Everything from the head and neck anatomy to dissecting a human body. We had to do all of this to studying teeth, to just all science. And you wouldn't believe that you have to do this as a dentist, but yes, we had to go with the medical students the first year of dental school, dissect the human body, dissect the brain, the arms, have tests on the body, like smell formaldehyde. Just, it's an experience. It was one of my favorite, hardest times in dental school was that first year, was gross anatomy with Dr. Jackson. Dr. A. Jackson. It was hard, but it was fun because I'm like, dang, I'm living my dream. I'm actually in here dissecting the body. Like, this is crazy. If nothing makes you feel like you really have made it to dental school, is that moment when you're like, what? I gotta do what? And you get so used to it. Those tests are so intense. Like, that is a hard class. That's probably one of the hardest classes I ever took in my life, gross anatomy. But I'm getting sidetracked. Where was I? All right. Oh, dentistry combines science, artistry, because, you know, we work on teeth. It's cosmetics. We do the veneers, braces. It's about designing the smile, and psychology. Working on people's psychology. Having that bedside manner. getting people to understand teeth and their smile. Kind of like what I'm doing now to get you to understand how important it is to think about your teeth now versus later. Or even just dealing with the anxiety from patients and dealing with fear. We deal with a lot when it comes to dentistry in the office. Number 100, a good dentist doesn't just fix teeth, they change lives. Kind of like what I want to do right here. Change your life for the better. Not just fix your teeth, but change your life. All right? We on the last little stretch of this 150 facts that we should know about oral hygiene. Now that's crazy. 150. Is Dr. Sean crazy or what? Not crazy, just passionate, I would say. 101. Wisdom teeth erupt between the ages of 17 to 25 if there is room. Sometimes a little earlier, sometimes a little later, depending on who you are. But that's the normal age, 17 to 25. 102. Impacted wisdom teeth can cause infections, cysts, and crowding. That's why I had my wisdom teeth out, because they were growing in wrong, and I was getting something called pericoronitis. There was a flap of tissue over my wisdom tooth, and the food would get stuck back there, and it would swell up, go down. So I'm like, I got to get rid of it. That was an infection. They can cause cysts and crowding. I had a little crowding happening. Yeah. 103. Not everyone needs their wisdom teeth removed. It depends on spacing, the biting, and your hygiene. I've met very few people who have all their wisdom teeth in the mouth. They're healthy, and they had enough room. Not a lot of people have enough room for them. 104. Dry socket is a painful complication after extraction. So you got to avoid smoking and sipping through a straw so that you don't get rid of your blood clot or that you don't kill the blood vessels. So if you get an extraction, do not smoke. Do not smoke. Don't smoke. Dry socket hurts worse than a toothache. If you ever had a dry socket, put dry socket in the chat for me. Put dry socket in the chat for me. And was it painful or not? When I had my wisdom teeth out, my mouth was sore for like a week and a half. Like it was swollen. It was sore. I didn't get dry socket, but the smell of the blood was just like, oh, like, it just was an experience. It was. Alright. Number 105. Third molars are evolutionary leftovers. Our jaws have gotten smaller. So if you're wondering, dang, why don't I have enough room for my wisdom teeth? It's because our face has gotten smaller over time. Okay? 106. Panoramic x-rays help plan surgical removal of extraction. So when you go to the dentist and they take the big picture of your teeth, of all the teeth, those panoramic x-rays show a panoramic view of the teeth in the mouth, along with other important structures that we need to evaluate before we go to take out the teeth. Like, I don't take out all wisdom teeth because sometimes they're too close to the inferior alveolar nerve. They may be too close to the sinus. They may be just completely impacted. It just could be a lot going on. So the panoramic x-ray helps us determine if it's safe or should I refer to the specialist, right? 107. Ice, rest, and soft food aid recovery after your extraction. So ice, rest, and soft foods. Okay? And you don't want to use the ice for long periods of time, maybe like 5 to 10 minutes at a time, not the whole time. 108. Numbing agents like lidocaine work locally. You stay awake, but you don't feel pain. So I have patients come into the office like, Doc, are you using the anesthesia today? Do I need a driver? You don't need a driver when we're doing like fillings and when you get lidocaine or when you get carbocaine. These things work right locally. They don't travel to your body and make you woozy and sleepy. So you can get a feeling and go back to work. You can get a feeling and drive yourself home. People sometimes don't think that. All right. Number 109. IV sedation is available for anxious patients. So if you are scared, you can find dentists who do IV sedation to help you calm down. This is very important. If you're going to get an extraction with the oral surgeon of your wisdom teeth and you already nervous, just get sedated and let them do their job, and so you don't have to experience it. I didn't do that. I don't know if I couldn't afford the IV sedation or if I was scared to go to sleep, but I wish I would have did that. But hey, once you make your choice, you stuck with it, kind of. All right. Number 111. No. We're on 110. Oral surgeons specialize in extractions, implants, and jaw procedures. But they also specialize in facial reconstructions. They are very, like, if you have a car accident, things like that, oral surgeons do highly valuable detail work in those arenas. The wisdom teeth, all of that. Great profession. I would say, if the hood wasn't a part of my story and I would have been able to not like work and go to school, and if I could just focus on school, I would have definitely pursued oral surgery. But that requires more dedication than I had, I guess, and more, it just requires something that I didn't have. But that is a great profession. Number 111, always follow post-op instructions. Infections are no joke. So if you have an extraction, any procedures, make sure you follow your doctor's post-op instructions. Don't try to go and smoke when you had a tooth extracted. No, don't do it. Save yourself the pain. You ain't gonna want to do that when your tooth when the socket starts to ache and you can't figure out why. All right. 112. Some wisdom teeth surgeries require bone removal or stitches. So sometimes we have to remove the bone around the teeth because it's locked in with the bone. 113. Early removal before root maturity often leads to a quicker healing with your wisdom teeth. So parents out there, if you are taking your kids to the dentist, like hopefully you should be, if the dentist notices the wisdom teeth growing in an awkward position, if you get those teeth taken out earlier, it won't be as traumatic because the teeth didn't form roots yet. Once they form the root and they get locked into the bone, those can be a lot more traumatic to take out and not as easy if you wait till they mature. 114. Extraction is a rite of passage. It is a case-by-case decision. I do not recommend all people take their wisdom teeth out. It is a case-by-case decision. So if you have wisdom teeth, you're like, well, when I'm supposed to take them out? Do you need to take them out? Are you qualified to have them out? Sometimes they're in bad positions on the nerve where you can't touch it. So it's a case-by-case decision. It is not something that you have to do. Okay? If you are in your 30s and 40s and you still have your wisdom teeth, get them checked out. One of my wisdom teeth was growing in like a train. It was causing decay on the tooth in front of it, number 18, and that was an issue. So the earlier you get it checked out, you can find these things and hopefully avoid cavities. We almost done with this list, guys. 150 things you should know about your teeth. I'm still here. I can't believe it. I was going to do 100, but then I said, let me do 150. The streaming life of a dentist. All right. So, let's go over our last little section, which is fun facts, jaw droppers, and some closing gems for you. Okay? 116. Teeth are like fingerprints. No two are the same. Did you guys know that? Your teeth are like fingerprints. No two teeth are the same. 117. Right-handed people tend to chew more on the right side. So when you're chewing, if you're right-handed, see what side you prefer to chew on. I think that's a really cool fact. Like, yeah, I'm definitely right-handed and I chew more on my right side. 118. Tooth enamel can't regenerate once it's gone. So once your tooth enamel is gone, it is gone. It doesn't come back. Now, disclaimer, there has been research released this year where they are in the process of regrowing teeth. But this is something that's super new. Not available yet. We don't know how the teeth look when they grow. Are they going to grow like molars, incisors? These are the questions I ask. Do you have a specific um, germ cell that makes the molar that you can implant? Like, how are they, but that is the current news. 119, chewing on ice is a common cause of cracked teeth. My mom, right here, she was an ice chewer. Back in the day, they used to scrape it out the freezer, the deep freezer, and chew on ice. But chewing on ice can cause your teeth to crack. So be careful with chewing on ice all the time. Ice is very hard. You're stressing your teeth out just chewing on ice. And it can wear down the cusp of your teeth, make them really jagged and chipped off. All right? Number 120, the average person spends 38.5 days brushing their teeth over a lifetime. 38.5 days brushing their teeth over a lifetime. All right. 121, ancient civilizations used twigs as toothbrushes. Miswaks are still used today. I had some patients from overseas. They still use those chew sticks to clean their teeth. Some people don't use toothbrushes, but this is an ancient practice where they chew on the sticks, and this is supposed to clean the teeth. So it's different all over the world. My knowledge is mostly American based, but different things for different folks depending on your culture. Number 122, the first commercial toothpaste was made in 1873. 1873 by Colgate. So Colgate has been around for over 150 years nearly. That was the first commercial toothpaste. But we've been making it for a while, or chewing on twigs. Number 123, toothbrushes should be stored upright and air dried. So when you go to Dollar Tree and you see those things where they have it where you put your toothbrush in it and you close it up, this is not good. Your toothbrush should be upright and air dry. So, for example, my electric toothbrush, when I put it on the charger, it sits upright and it air dries. There's not like a cover for it or something to keep the bacteria and the moisture in, because that's what breeds bacteria. When you have that moisture and you're putting the toothbrush cap on it, don't do that. Don't wrap it in aluminum foil. Don't do none of that. Let it air dry. Very, very important. 124, kissing transfers 80 million bacteria per smooch. Yes. So make sure your partner is brushing and flossing as well. So kissing transfers 80 million bacteria per smooch. So you can't just be kissing on everybody. Okay? Don't do it to yourself. Don't do it. Don't do it. Okay? 125. The earliest toothbrushes came from China and were made of boar hair. 126. We already had that one. Dental implants fuse with your bone through osseointegration. That's number 26. 27. Unlike your teeth, dental implants do not move in the bone. So your teeth have something called PDLs, periodontal ligaments, and they allow your teeth to kind of move when you chew, so they're not like stuck. A dental implant is rigid. It fuses to the bone. Osseointegration. Alright? So they feel different. They don't feel like your natural teeth. They're a great supplement, but they're different. 128. Some people are born with extra teeth. This is called supernumerary. So remember, normally we have 32 teeth. 4 of those are wisdom teeth. But if you have more than 32 teeth, which some people do, this is called supernumerary teeth. Because you have a super amount of teeth. You just was blessed with more than the rest of us. Alright? 129. Your smile is the first thing people notice. Your smile. So make sure you're smiling. Make sure you're smiling, guys. 130. Chewing gum after meals increases saliva and reduces risk of decay. Make sure your chewing gum has xylitol. So chewing gum after your meal is going to help get the saliva flowing and help you decrease your chances of tooth decay. But not just any chewing gum, sugar free or xylitol chewing gum. All right. 131. Nail biting. So I'm an ex nail biter. Nail biting, chewing on pins, and clenching all damage your enamel. So you like to chew on pins, bite your nails, this damages your enamel. So make sure you are not doing these things. Number 132, your molars can handle up to 200 pounds of pressure. Your molars are very strong. They have a lot of force back there. So make sure you don't put your finger in somebody's mouth. Y'all, I had a patient, a little girl, she bit me and she was like, she looked at me with a vengeance like, get out of my mouth. I would never forget it. Her mom was like, let her finger go! Let it go! I was like, oh my gosh, little girl, if I wasn't a dentist. The things we have to deal with as dentists. 134. The bacteria in your mouth outnumber the number of people on earth. So there's millions and millions of bacteria in your mouth. All right. 135. Tongue scrapers reduce odor and improve taste. The tongue don't get enough love, but make sure you use a tongue scraper to clean your taste buds, reduce the odor that you have because your tongue could be emitting an odor, and to improve the taste of your food. So if you haven't brushed your tongue all year, try it. Clean your tongue off. Show your tongue some love. 136. Dental fear often stems from childhood trauma or lack of understanding. I kind of touched on this already. 137. Children mimic adult habits. So if you don't brush, so when I talked about people saying bad teeth running in their family, a lot of times it's bad habits running in your family. It may not be bad teeth, but you're learning something, the bad habit from your parents. Maybe your parents don't floss, so you don't floss. You don't know nothing about it. Your parents only brush once per day, so they're not going to force you to brush 2 times per day because they don't even have that habit. So this could be a problem. So the children in your household are going to mimic the adults. So if your kids got cavities, guess what? They're learning the bad habits from you. They're learning it from you. So brush as a family, especially with your younger children, so they get into their own routine of brushing their teeth. And make sure you check to make sure they're doing a good job. 138. A missing tooth can cause other teeth to shift. Facts. Because the teeth are going to move to the front. If you're missing a tooth, the other teeth shift. Which is why you want to keep the baby teeth, because if you don't, the teeth can get out of alignment fast. 139. Oral health is linked to self-esteem, confidence, and success. So this whole 150 facts is getting you closer to confidence. It's getting you closer to success. It is getting you closer to having the highest possible form of self-esteem when you can love your smile. Imagine not being able to smile because you don't love your smile. You don't love your teeth. That reduces your confidence. This lowers your self-esteem. And it decreases your success because you're not going to go into those interviews or go to start that business and meet these new clients because your smile. You know, it can be a hindrance. So show your smile some love today. And just smile. Just smile. It takes less muscles to smile than to frown. It takes a lot to be like, you got to do too much to do that. Like, all day you just mad. Like, just smile. It don't cost nothing to smile. It don't. It really don't. All right. Next, we are almost done. I can't believe we did it, man. I can't believe we did it. Now I'm lost. Okay, number 140. 10 more to go. We on the countdown. Mm, mm. Dentures don't last forever. They require relines and replacements. Sometimes a dog eat the dentures. Sometimes people drop their dentures. Sometimes they wrap it in a paper towel and they throw it away. Sometimes the bone shrink. But dentures often require relines and replacements if they get outdated. Okay, but I've had patients who had their dentures for 20, 30 years and getting them to separate from it is like impossible. And that's great. That's what you want. People who love their dentures for a long term. 141. Bleaching too often can cause not only gum sensitivity but gum irritation. I meant tooth sensitivity, but gum irritation. It can be very irritating to your supporting tissues. So be careful with that. Don't bleach your teeth too often. I don't even like bleaching, honestly. I've done professional bleaching like once and my teeth became sensitive and I didn't like it. I don't like having sensitive teeth, so I stopped. But I do bleaching for patients, but I make sure I let them know, hey, don't do this often. This can cause sensitivity that you can't get rid of. Alright? Number 142, you're never too old to straighten your teeth. So if you have teeth that you would like to straighten out, look into Invisalign. Clear aligners. It's never too late to straighten your teeth. Some people feel like I'm too old now, I don't want to. But imagine your success, your confidence, your self-esteem. If this is something you want, make that investment. Don't be afraid. Just try it. It can be life-changing. Life-changing. Okay? 143, snoring and sleep apnea often show signs in the mouth. We already know that. Snoring and sleep apnea both show signs in the mouth. Your doctor can see the signs. Scalloped tongue is a sign. 144, only 20% of people floss daily. So I highly advise you to be in Dr. Sean's elite squad and be one of those elite people. You'll be a rarity. You'll be among the 20% if you just take this habit. I'm trying to tell you. 145, saliva is the body's natural defense mechanism. Okay? So we've been talking about saliva a lot. We talk about teeth, we talk about the tongue, we talk about the gums, but saliva is important as well. Without the saliva, you get a lot of dry mouth, decay, things start to go crazy. So make sure you are drinking water, doing the things that don't harm your teeth or your mouth or your blood vessels. 146, dental health is wealth. Poor smiles cost opportunities. This is what this whole thing is about, knowing that dental health is your wealth. Dental health, because a healthy smile is a wealthy smile. So know that. Some people don't get jobs, don't get opportunities. If you want to be an actor, all these things, a lot of people are going to not include you because you have a poor smile and you're not taking care of your smile. So you'll see these influencers, the reason why they go and get veneers is because they want to improve their appearance, their smile, their confidence, their self-esteem. Okay? And they want more opportunity. I'm not saying go get veneers, I'm just saying have a healthy smile. Because even pain can clock you out of an opportunity. If you have a toothache all the time, how you going to be a boss and level up and run a business when you got a toothache all the time? When your teeth are hurting, your mouth is uncomfortable, you let it go out of control. Before it get worse, fix the problem now. 47, confidence start in the mouth. You wear your teeth every day. You can't just take your teeth out, put on a new set today, take this out, put on a new set tomorrow. This is something you wear every day. So the confidence starts in the mouth with the teeth. Our last three, 148. Most people don't know what healthy gums look like, but they are pale, pink, firm, and tight. Not inflamed, not red, not bleeding, not dirty, not full of plaque and bacteria. They are like a pale pink, firm, and tight. If you are melanated, then your gums may have melanin. 149. Dental intelligence is life intelligence. Make sure you share this knowledge. Make sure you share this broadcast, because knowing about your teeth is knowing about your life. Okay? And last, 150. Your teeth are your ancestors' legacy. Protect them like your story depends on it. Alright? So yeah, we just did 150 things you need to know about teeth, guys. So now I'm going to be taking some questions. So drop your questions in the chat. I have to get my little dental stuff included in the podcast from time to time. You know, so we can continue fulfilling our purpose. It seems like we do not have any questions about this topic, so I'm gonna hop on off of here, guys. And thank you for joining me. If you watch this on the replay, make sure you smash that like button. And yeah, I'll probably be back today on Twitch a little bit later, just to hang out. But I gave y'all the meat and the potatoes for the day. Hopefully, lots of stuff that you can use and share with your family. Alright. It's time for me to go get something to eat. I've been on here for a while now. Time to get something to eat. All right, chat. I will holler at y'all later, alligator. This has been another Hood to Hood podcast with 150 things you need to know about your oral hygiene routine. This is Dr. Cheetah's Sunflower, and I'm out. Make sure y'all follow me on Twitch. Make sure you follow me on Twitch. I will not be going live on all platforms all the time. I'm just doing this right now. For the next maybe couple months, but make sure you follow me on the main platform, my main streaming platform, that is. All right, have a good day, guys.